Aloha and welcome to the Stop Flu at School Clinic Staff Training video. This video provides an overview of the operations required to set up and manage a school-located flu vaccination clinic and the roles and responsibility of the clinic staff. To complete the training, you'll need to review all training materials provided based on your clinic role. Completion of this training and a passing score on the post-test are required for all Stop Flu at School personnel prior to the participation in the clinic. Clinic personnel must pass the post-test with at least 70% score. Course participants who do not pass a post-test within 3 attempts will not be eligible to work at the clinics. If you experience any problems with this online training, please contact the help desk before attempting to complete the post-test 3 times. You can email schoolflu.helpdesk@doh.hawaii.gov, or you can call 808-586-8300 or 1-800-933-4832, Monday through Friday from 7:45 a.m. to 4:30 p.m., excluding state holidays. Let's begin with some background information on influenza and Hawaii's Stop Flu at School program. Each year in the United States, influenza disease results in millions of doctor visits and thousands of hospitalizations and deaths. Certain conditions may put children at high risk for severe complications, but even healthy children can become very ill or even die from the flu. According to the Center for Disease Control and Prevention, approximately 80% of children who died from the flu were not vaccinated. And while no vaccine is 100% effective, the single best way to prevent influenza and its complications is to get vaccinated each year. A yearly flu vaccination is recommended for everyone 6 months or older. The flu shot is an inactivated influenza vaccine that is administered by intramuscular injection. Some people should not receive the flu shot. These include persons with severe allergic reaction to eggs or to a component of any flu vaccine, persons with a severe allergic reaction to a previous dose of influenza vaccine, persons with a history of Guillain-Barré syndrome, and persons with a moderate or severe acute illness. Questions 1, 2, and 3 on the consent form screen for contraindications and precautions to the flu vaccine. Stop Flu at School vaccination clinics are held in participating schools statewide and operate during normal school hours. Parental consent is required prior to vaccination. The Stop Flu at School clinics utilize the Incident Command System, also referred to as ICS. 2 main principles of ICS are the chain of command and unity of command. Chain of command is the top-down order of authority through which instructions are given and received. Unity of command is the principle that all staff report and take assignments from only one supervisor. Clinic managers are the lead authority at every clinic. All staff ultimately take orders from the clinic manager, either directly or indirectly through their immediate supervisor, such as the line flow group supervisor or vaccine group supervisor. Each clinic's organizational structure may vary, but every clinic will have a clinic manager to run operations. It is important for all staff to be familiar with the standard clinic setup and flow. Clinic setup may vary depending on the location and the size of the room. Students will arrive at the entrance and proceed to the registration station, where their consent form is screened. After reviewing the information provided on the consent form, registration staff will direct participants to the vaccination waiting area. Line flow staff will then direct participants to the vaccination stations. Vaccinators will administer the vaccine and direct participants to the holding area. Each participant must be seated for 15 minutes in the holding area for observation before exiting the clinic. All staff must report to the clinic site 30 minutes prior to the clinic start time. There are penalties for repetitive lateness. Be sure to allow ample time for transportation, parking, and locating the clinic site. Parking is limited at many schools, and you may be required to sign in at the school office before proceeding to the clinic site. Parking and check-in instructions will be provided to you before the clinic date. When you arrive at the clinic site, check in with the clinic manager and sign in on the 211 and 211V form. You will receive your assignment and be provided a job action sheet which outlines your duties and responsibilities. Everyone will obtain just-in-time training, which is just a brief refresher of important information and updates. Vaccinators will receive an identification code for documenting vaccinations and will review the standing orders. Everyone will assist with clinic setup and perform their job duties as assigned. At the conclusion of the clinic, all staff will assist with cleanup and packing of supplies, and ensure that the clinic site is returned to its normal condition. Note that personnel who have not received blood-borne pathogen training will not handle potentially infectious material such as hazardous waste containers and used syringes. Everyone must sign out on the 211-211V form before leaving. If you are assigned to return supplies or vaccines to the Department of Health, complete the delivery in a timely and secure manner. Here are some important reminders for all clinic staff. Act professionally and courteously. Dress appropriately, wear covered shoes, and bring your ID and agency identification badge. Bring bottled water and snacks in the event that there is a break. However, eating and drinking are not permitted when the clinic is in operation. Do not use cell phones and other electronic devices on school premises, and do not take photos or videos on school property. Registration staff are responsible for thoroughly reviewing student consent forms. When reviewing a consent form, match the name on the form with the participant to be vaccinated by comparing the name on the form with the student's name badge. Inform the group supervisor or clinic manager if the name on the form does not match the student's badge, or if the groups of students come to the clinic without name badges. If an individual student does not have a name badge, ask the teacher to verify the student's identity. Review each consent form for accuracy and completeness. Information that must be provided on the consent form include the student's first and last names and date of birth, answers to all screening questions, signature of parent or legal guardian, and date. Blue or black ink are preferred, but consent forms legibly completed in other colors or using other writing utensils will be accepted. If any screening questions is marked yes or was left blank, refer the student to the group supervisor or clinic manager. Verify that the For DOH Use Only section at the bottom of the form has not been completed. If this section contains written information or notes are found anywhere on the form, refer the participant to the group supervisor or clinic manager. If the consent form has been completed appropriately and no issues have been identified, direct the participant to the vaccination station waiting area. The notification form is used to inform the parent or guardian that their child was or was not vaccinated. Write the student's name and the clinic date on the notification form. Give the notification form and consent form to the student and direct them to the vaccination station waiting area. If a student reports that they have already received the vaccine and or is not feeling well, refer the student to the group supervisor or clinic manager. Also report any issues or apprehensive participants to the group supervisor or clinic manager. It is the responsibility of the registration group supervisor to problem solve with registration staff regarding incomplete or incorrectly completed consent forms. Common errors on the consent forms include student's birth year is the same as the current year, screening questions are not answered, or the form is signed but not dated. Registration group supervisors should consult with the clinic manager on these issues. Registration group supervisors should also ensure that each registration station has enough supplies. Inform the section chief or clinic manager if additional supplies are needed. Clinic personnel issues should be directed to the clinic manager. It is the responsibility of the line flow staff to direct participants to the vaccination station, monitor participants in the waiting areas, and to maintain the flow of the clinic by redirecting participants to the proper station if found wandering. Line flow staff should investigate backups and take corrective actions as needed to resolve clinic flow issues. It is the responsibility of the line flow group supervisor to monitor line flow staff, investigate backups, and take corrective action. Consult with the section chief or clinic manager as needed regarding clinic flow and personnel issues, and assist with directing participants to maintain the flow of the clinic. It is the responsibility of observation area staff to monitor students after vaccination. Participants must be seated for 15 minutes in the observation area before returning to class. If possible, have students sit on the floor. Participants in the observation area must be seated throughout the entire observation period to reduce injury if fainting occurs. Staff should be actively monitoring the area and watching for signs of adverse reaction. If a participant experiences any adverse reaction, contact the group supervisor or clinic manager immediately. All vaccinators must review, understand, and adhere to standing orders for vaccine administration and management of acute adverse reactions to vaccines. An emergency kit containing supplies and medications is available at every clinic. The clinic manager will check the emergency kit contents and notify staff of its location before the clinic begins. Vaccinators must carefully review each consent form before administering vaccine. One key to preventing serious adverse reactions to vaccines is screening for contraindications and precautions. Do not skip this step. When reviewing a consent form, match the name on the form with the participant to be vaccinated by comparing the name on the form with the student's name badge. Review each consent form for accuracy and completeness. Information that must be provided on the consent form include students' first and last names, date of birth, answers to all screening questions, signature of parent or legal guardian, and date. If any screening questions is marked yes or was left blank, refer the student to the group supervisor or clinic manager. Verify that the For DOH Use Only section at the bottom of the form has not been completed. If this section contains written information or notes are found anywhere on the form, refer the participant to the group supervisor or clinic manager. If a student reports that he or she has already received the vaccine or is not feeling well, refer the student to the group supervisor or clinic manager. Do not complete the For DOH Use Only section of the form until the vaccine has been administered. If the consent form has been completed appropriately and no issues have been identified, administer the vaccine following the standing orders. Before vaccinating each patient, clean your hands with hand sanitizer. Gloves must be worn if the vaccinator has open lesions on hands or if the vaccinator is likely to come into contact with potentially infectious body fluids. If gloves are worn, they must be changed between each patient. Clean the administration site with an alcohol prep pad. Administer a 0.5 milliliter dose of flu vaccine intramuscularly into the deltoid muscle. Administer the vaccine into the muscle tissue below the dermis and subcutaneous tissue. Stretch the skin taut to avoid ejection into the subcutaneous tissue. Injection is to be made at a 90-degree angle, and the needle size is to be 23 to 25 gauge with the length of 1 to 1.5 inches. After injecting the vaccine, continue to depress the plunger of the syringe to activate the needle retraction device while the needle is still in the student's arm. After the needle is retracted, put the used syringe immediately into the sharps container. If the needle retraction device malfunctions, do not try to force it. Remove the needle from the student's arm and put the used syringe immediately into the sharps container. Do not recap contaminated needles. Inform the vaccination group supervisor or the clinic manager of the syringe malfunction. Remember that all vaccinators must use hand sanitizer between patients. If gloves are worn, remove them after each patient and use hand sanitizer prior to putting on a new pair of gloves. Students will not be physically restrained by clinic staff for vaccine administration. If a syringe leak or malfunction occurs, Or if the student moves during a vaccine administration and does not receive the dose or receives a partial dose, inform the clinic manager immediately. The clinic manager must contact the parent or guardian for permission prior to revaccination. If the clinic manager is unable to reach the parent or guardian, the student will not be revaccinated. The vaccinator will document vaccine administration on the consent form. Do not document on the consent form until after the vaccine has been administered. First, record the date that the dose is administered. Then indicate the vaccination site by circling RA for right arm or LA for left arm. Be careful to circle only one vaccination site. Next, use the pre-printed stickers to record the manufacturer, lot number, expiration date, and VIS publication date. Finally, write your assigned vaccinator ID code on the form. This code corresponds to a number on the sign-in sheet and identifies the individual administering the vaccine. Quickly scan the consent form to make sure all fields have been completed accurately. Keep the original consent form. These must be collected and returned to the Department of Health. Complete the parent-guardian notification form, which the student will take home. If a student received the vaccine, complete the vaccination information. If a student did not receive the vaccine, indicate the reason for not receiving the vaccine. Give the completed parent-guardian notification form and a stamp, sticker, or other incentive if available to the student. Direct all participants to the observation area. Vaccinated students must remain in the observation area for 15 minutes before returning to class. Participants in the observation area must be seated to reduce injury if fainting occurs. If possible, have students sit on the floor. Before submitting completed consent forms to the group supervisor, review documentation on each form to ensure accuracy and completeness. Be sure each form has the correct date of administration, there is no missing information, such as the vaccinator ID code or lot number label, and ensure the flu shot not given section is not completed if the student was vaccinated. The vaccination group supervisor oversees the vaccine administration area. It is their responsibility to supply vaccines to vaccination stations as needed and to notify the logistics section chief or clinic manager of supply issues. The vaccination group supervisor is responsible for maintaining the vaccine cold chain by keeping the vaccine in the storage coolers provided. Vaccine vials will be removed from the cooler only as needed to draw doses into syringes. The filled syringes will be placed into small tabletop coolers, which will remain zippered when not accessing the vaccine. The vaccination group supervisor will oversee the pre-filling of syringes, which includes verifying that the lot number on the vaccine vials matches the lot number on the pre-printed stickers, and ensuring only 10 doses of vaccine are drawn from each vial. Empty vaccine vials should be put in sharps containers. The vaccination group supervisor will monitor the vaccinators to ensure that they are reviewing the forms carefully and administering vaccine appropriately. Concerns regarding inappropriate vaccine administration should be brought to the clinic manager's attention immediately. The vaccination group supervisor will also ensure that all hazardous materials are attended to and monitored by clinic staff and are not easily accessible to non-clinic personnel. Vaccination group supervisors should review all forms to ensure accuracy and completeness before the conclusion of the clinic. The following slides will present information about the management of acute adverse reactions to vaccines in the Stop Fluid School Clinic. All vaccines have the potential to cause an adverse reaction. These reactions can range from mild, localized reactions to severe and life-threatening anaphylactic reactions. Personnel administering vaccines must be prepared to recognize and respond immediately and appropriately to life-threatening adverse reactions. Localized reactions to a vaccine are generally the least severe and the most frequent. They may include pain, swelling, and redness at the site of injection. This type of reaction generally occurs within a few hours of the injection and is usually mild and self-limited. Sometimes a patient will experience syncope, also known as fainting. To prevent falls in the clinic, assure that the participants sit down post-vaccination and observe them for 15 minutes while they wait in the holding area. Here is a list of syncopal symptoms. It includes fright before vaccination, paleness, sweating, cold hands and feet, nausea, lightheadedness, dizziness, weakness, visual disturbances, loss of consciousness, and falling. If a participant experiences syncope, have the patient lie flat or sit with their head between their knees for several minutes. Loosen any tight clothing and maintain an open airway. Check their vital signs, pulse, respirations, and blood pressure. Apply a cool, damp cloth to the patient's face and neck. If a patient falls or loses consciousness, examine to determine if an injury is present before attempting to move the patient. Place the patient flat on their back with their feet elevated. Call 911 if the patient does not recover immediately or if an injury is present. Once consciousness is regained, patients should be observed until they're asymptomatic. An anaphylactic reaction is caused by an allergy to the vaccine or vaccine component. Though rare, it may be severe and life-threatening. Thorough screening of all consent forms is emphasized throughout this training so that the risk of an adverse reaction is minimized. An allergic reaction may begin almost immediately after the vaccine is given, and it requires rapid recognition and treatment to prevent progression to cardiovascular collapse. Please review and be able to recognize the following signs and symptoms associated with anaphylaxis. These include generalized hives, itching or redness, or flushing of the skin, swollen lips, face, throat, tongue, and/or uvula, respiratory compromise, gastrointestinal tract symptoms, cardiovascular signs such as reduced blood pressure, syncope, cardiovascular collapse, hypotonia, and incontinence. An emergency kit will be available at every clinic. It contains medications and supplies necessary to initially treat an individual who experiences an anaphylactic reaction. Kits include epinephrine, diphenhydramine, syringes and needles, blood pressure cuffs, stethoscopes, and other supplies. If a participant experiences anaphylactic reaction at a clinic, notify the clinic manager. If symptoms are generalized, call 911 immediately. Assess the patient's airway, breathing, circulation, and level of consciousness. Place the patient in a recumbent position. Make sure that the airway is clear. Use manual resuscitator if necessary. If no pulse, begin CPR. The first line and most important therapy in anaphylaxis is epinephrine. There are no contraindications to epinephrine in the setting of anaphylaxis. Using the recommended dosage of 0.01 milliliter per kilogram per dose, administer epinephrine intramuscularly. To ensure an appropriate and timely response to an anaphylactic reaction, it is critical that you review and understand the standing orders before performing your job duties at a clinic. For generalized hives or itching, diphenhydramine may be administered intramuscularly at a different site than that given for the epinephrine. The standard dose is 1 to 2 mg per kilogram of body weight, up to a maximum dose of 50 milligrams. Monitor the patient closely until EMS arrives. Perform CPR or assist with respiration if necessary. Elevate legs if blood pressure is low. Monitor vital signs every 5 minutes. If EMS has not arrived and symptoms are still present, administer epinephrine intramuscularly at 5 to 15 minutes intervals, or more frequently as necessary to control the symptoms and maintain blood pressure. Up to a total of 3 doses, depending on the patient's response. Record signs and symptoms, all vital signs, medications administered, including time, dosage, site, response, name of the person who administered medication, and other relevant clinical information. All patients showing signs and symptoms of anaphylaxis, regardless of severity, must be referred to an appropriate medical facility for treatment. This concludes the Stop Fluid School Clinic Staff Training video. If you have any questions, email schoolflu.helpdesk@doh.hawaii.gov or call 808-586-8300 or toll free 1-800-933-4832.